Do you have ADHD and do you sometimes feel like you have super senses? My name is Bridget, I'm a nurse practitioner, I have ADHD. And I didn't know I had ADHD until I was an adult. I've always had symptoms, even as a child, but especially coming from a Latin community, I'm Colombian. Our culture oftentimes doesn't do a great job of identifying certain traits as diagnoses versus they end up blaming the individual. So for example, I was always told I was just disorganized instead of that I struggled with disorganization, right? I have ADHD, I am not the diagnosis. I experienced a lot of shame for a lot of things like being disorganized, being messy, being forgetful, losing things. But then another thing that I experienced that I did not know was a part of ADHD was extremely hypersensitive senses. Now, there are other disorders where senses are heightened, so it's important to not self-diagnose and to always talk to your healthcare professional, psychiatrist, counselor, therapist to make sure that this is the correct diagnosis for you. For example, individuals with autism, they can also experience increased sensitivity to certain textures, sounds, things of that sort. But ADHD seems to exacerbate and exaggerate everything, especially our senses. If you taste, smell, or hear in extremes, you're not alone. And here are some common ADHD sensitivities. In this video, I will be discussing some common ADHD hypersensitivities and how to help dial them down. So how is it that other people can brush off little annoyances like bright lights, grating sounds, scratchy clothing? They're okay with it. And oftentimes we'll be told you're too sensitive. And again, it's internalizing all of these things that society tells us that gives us shame when you get the diagnosis and you realize that there's actually a reason why you are too sensitive. It's because you're neurodivergent. And that is just reassuring that it's not just you, that this happens to a certain subset of a population. So it's completely normal if you experience these hypersensitivities because it's part of ADHD. Write in the comment below, what is a trigger for you? For me, I cannot touch velvet. I cannot take the texture of velvet. It gives me like little goosebumps. It's almost like nails on a chalkboard. So certain tactile sensitivities, I'm in a neurodivergent group on Facebook. A lot of them will say it's like microfiber towels. But for me, clothing tags really bother me. So I will buy clothes that don't have tags or have everything already printed on the clothing, or I just cut the tag off as close as possible, because even if you don't cut it close enough to the clothes, it's like that little bit of it can still irritate you. Auditory sensitivities, if I was taking a test, a little drop of a faucet, drip, 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 or someone tapping their pencil, we are hyper aware of everything. We see everything, we notice everything, we hear everything. Loud noises, repetitive sounds like a clock ticking. Olfactory senses, even taste. So growing up, there were these drinks called Mondo, and I didn't like, they came in like these plastic bottles and you would twist the cap off, and I didn't like how they tasted, that I could taste the plastic in them. What I suspect is like the plastic scent would leach from the plastic bottle. We now know that plastic is not an inert substance, like it does leach into things, into beverages, or that's why they make BPA free stuff now. So back in the day, before this whole BPA free movement, I'm sure that was full of BPA, but I could taste the plastic in the Mondo drinks. And I would tell my sister, I'm like, this tastes like plastic. And she's like, you're crazy. And I'm like, you don't taste the plastic? Like, I can literally taste the plastic. I used to have an ex that said I could give canines at an airport a run for their money. Now, of course, this is a hyperbole. The smelling capabilities of canines are infinitely more advanced than mine, but because I could smell things so well, he's like, man, you're like a dog. Like, you could just smell anything. So things that may smell bad to someone else are just completely like putrid to us, like intolerable to us, where we just cannot be around it. So certain perfume spray, deodorants, hairspray, diesel, like any one of those could set you off. Visual sensitivities, bright LED light. I don't suffer from this. Claustrophobic sensitivities, I don't mind being in closed spaces. However, you may get claustrophobic where there's just too many people, and I don't like to be in large crowds or around too many people. That is something that I don't like. This article is from ADD Attitude Mag. That's where I got a lot of this information if you want to check that out. But someone in this was interviewed for this magazine, and they said, I cannot tell you how many times I have left the grocery store leaving the cart nearly full because I was overwhelmed by all the stuff in the store. Sharon Heller is a developmental psychologist, and she specializes in sensory processing issues like hypersensitivity. And she says that a good treatment plan includes regular exercises, calming practices like yoga or meditation, and proper nutrition. I can tell you, when I first started doing yoga many moons ago, I didn't like it because of my ADHD. It was too slow. I couldn't focus. I was bored, but it has helped me tremendously. Stick with it. And you can try different kinds. You could try flow yoga. You could try hot yoga. You could try yin yoga. Now I love all kinds of yoga, and I do think that it's really helped me with my focus and concentration. She also says address each sensitivity alone, and this means treating the problem at the source. So if tags in your shirt drive you crazy, then either cut them off or buy tagless shirts like I do, right? Advocate for yourself. You know, you can ask people if they can turn down a radio or a TV. They may listen or they may not, but at least you advocated for yourself. If that doesn't work, you can move to a quieter area. I don't have my earplugs here with me, but I have these earplugs that are reusable so that they're eco-friendly. You can take earplugs, you can use your AirPods on noise cancellation mode. You can take a time out when feeling overstimulated at a public event without beating ourselves up for being too sensitive. So don't beat yourself up. Be kind to yourself. You could go to the restroom as your timeout, even if you don't have to use the restroom. It's just a way to get away from it all. And then lastly, exploit the positives. If you're emotionally sensitive, this likely means that you're extra intuitive and highly empathetic, and you would be successful working with animals, children, or as a therapist. If you're sensitive to sounds, someone with extra intense hearing could become an excellent musician or record engineer or recording engineer. Exploit your superpowers. Someone with extreme sensitivity to taste could become a professional food taster. I realize that I don't know anything about these careers or how hard it is to get into them, but try to see your superpower. How can you frame that in a positive context? Like, what could I do to exploit this in a good manner versus looking at it as a bad thing? If your hypersensitivity is interfering with your ability to function in your daily life, consider cognitive behavioral therapy. If you've been hypersensitive for a long time, and especially from infancy, you may also experience anxiety, which may also require therapy. It's okay to ask for help if you need help, and you're not alone. You're not alone. Having these hypersensitivities can be a blessing and a curse, right? A curse because we hear, smell, taste things more than others, but then because we do, that can also help us. Your senses can help you in areas of your life where you may not have expected that it can help you. It helped me as a nurse when I was a nurse because I notice everything, I would observe everything. I could walk into a room and just see potential, like, does my patient have his non-slip socks on? Is there anything if I was working in psych, is there anything in this room that could potentially be a hazard? How is my patient presenting? So we observe everything, we see everything, and it can be a blessing too. Thank you so much for watching. Make sure you like, subscribe, and turn on that notification bell.